Here we are at the Westminster Autism Commission report launch for harm against autistic people. There are some people I know here, there are lots of MPs. Emma's very, very excited. Just met Barry Sheerman, he's absolutely lovely. A lot of very nice people here, and we're just waiting for the speeches to start.
Really lovely. It was a reunion. You know that our first big report on access was very, very influential. People liked it. The Secretary of Health liked it. The Shadow Secretary of Health, all that team loved it. And we've had seen some really serious changes because we did the homework to present a sensible report. So this one is different. We talked to people and they said, what's uppermost in your mind? They said, it's not a big right? But we have this real problem. People who are on the autism spectrum, are in a family, who a member is on the autism spectrum, are being pressured by unscrupulous people who believe that there are sorts of helps and aids and fixes that are very unreliable, not based on any science, not based on any medical criteria, and we're very worried that this group is growing. And it's growing partially because social media allows unscrupulous people to inform, to communicate, and mislead. And so we said, right, we'll do the research, and we'll do it. And you know, that's what we did. And now, I've now been told I've got to keep my script. What a good week. Yes, we all got our badges on. It is the international, are we international or national autism week? World. That has nothing to do with my planning. I think it was to do with other people who make me do all the stuff I do, and they help me do it much better than I do it on my own. So, here we are, World Autism Awareness Week. And remember, get our dates. I used to be a bit of a historian. So September 2015, we started our group, yes? Cross-sectoral, inclusive, and we founded the Commission. One simple aim, to make the world a more autism-friendly place. If we have achieved that a little bit, please clap. Getting towards spring, we need to lighten up a bit. But it's been my pleasure to chair this recent inquiry from the Commission on Autism. And at times it's been a very worrying topic. I mean, people have come to really tears in terms of the pressure that they've been under and the unwise decisions, no fault of their own, but taken in terms of what they've picked up on the media. But I've been heartened by those of you already doing so much to ensure that autistic people are free from charlatans who peddle harmful products, harmful therapies and treatments for autism. The healthcare fraud is a big business. That's what we started. This is big business. People make a lot of money right across the piece, not just in terms of picking on people who have a connection with autism. Fraudsters promote the use of interventions which can result in physical, social, psychological and financial harm. And at worst, these interventions could result in death or lifelong physical or psychological harm. And for too long, autistic people have been the targets of fraudsters, offering a huge range of potentially lethal interventions for autism. Now, this report is a landmark moment when a coalition of voices has come together to say, enough is enough. Now, I've heard that, there's a big rally out here that enough is enough, but it's right in this context to say, enough is enough. Autistic people in their own cases have told us they had a range of dangerous, unsubstantiated products and therapies offered or suggested them, and worryingly were unclear on what to report their concerns to. And what was good about what we did, because we took evidence, we know that, and also we did one of our surveys, we realised that people just didn't know. Would you go to the people who deal with health or medical products? Do you go to food products? You know, it's very unclear what product was what. And so we've got very good advice, and we've come up with some very good suggestions. So, the findings from the report include consultation with autistic people and parent advocates and professionals. That consultation found that 89% of respondents think that the current laws or regulations for autism treatments are not fit for purpose. That's stunning. You get any survey of a sector, a community, 89% believe that that was the case. So, this report makes recommendations. Firstly, for improved policy and practice to ensure that no autistic person is misled into using a product or therapy as an intervention for autism which is unsubstantiated or harmful. And for the government to consider bringing forward not forcing them, but seriously consider bringing forward new legislation to make it illegal to offer to treat, prescribe or promote anything as an intervention, social or biological, for autism, unless by a certified professional. Now that's pretty clear. And the last bit, and it's a very important bit, the social media platforms to update their guidance to ensure that users who promote harmful interventions have their posts removed. Who would deny, this week of all weeks, that is a very important piece of advice. We know that social media can be used for all sorts of intrusive things. We know that certain owners of Facebook refuse to come to the House of Commons to give evidence. That makes it a bit tweet, makes it look like a bit of a gold-plated cow. Stronger language. If someone broke into my house many years ago, we had a burglar came in, I have to tell you, he didn't harvest our goods, he stole them. And when people call it harvesting, they're actually stealing information about your lives. And I think it becomes pretty unscrupulous when social media is used in a cynical way to target people. They can do it very, very carefully, very cleverly, as we know, very cleverly, to find out which people in our community have a member of their family on the autism spectrum. Absolutely have known it. They've got the data, they know how to use it, and then prey on scrupulous companies to use that social media to prey on that particular community. So, most importantly, this report marks the first time that the cross-sector coalition has united with one voice to express its concern and its desire for change on this matter. It's our hope that this report will set the path of greater attention on this issue, like the Commission's previous report, A Spectrum of Obstacles, an inquiry into access to healthcare for autistic people. This will lead to improvements in the lives of autistic people and their families. That's a very simple proposal. So, this is a landmark moment in a long campaign to ensure that autistic people are free from any form of harm, social, physical, psychological, or financial. We call on you to do the same. I'm pledging my commitment to this cause and will use the privilege of being a member of this Parliament to continue the cause inside this place. And so many members of Parliament coming here today have had their photograph and signed that pledge. So I think this is looking pretty good. I'm calling on each and every one of us to take some responsibility on this issue. Please join us all in pledging your support to end the harm that's being made and done to autistic people. Can I finish my sentence? Yeah? We've learned to know each other. We work as a great team. Yeah? And you can actually see it grow. You know, the friendship grows, and people come in and they smile and know they're in a friendly environment. And an environment where we build a team that has a purpose to make a difference for autistic people in this country and in this community. It's very early days. 2 inquiries don't really deliver everything. But we know how to do it now. And when our job now is to sell this quite simple report, clear, easy message to understand. Let's sell this hard this summer. In the autumn, let's come back and say, okay, we've done a really good job on this. If we carry on, we keep pushing it. But what is our next inquiry? What's the next area we can make? We're a little democratic body. Everyone will put their 2 pence in, and we'll come to a decision. And again, we will centre our because of the good sense of the people in this room where we'll make the most difference. Yeah? we've done two health, probably times move a little bit off health, so that will be up for discussion. So, wonderful report. All of us, I've done several radio and TV interviews, we'll be doing more this week. Anything you could do, local people, I have to say, on our social media. We don't tweet enough in our community. Yes? Let's get our views across. Let's sell this brilliant notice. We've got the Shadow Secretary of Health waiting to speak over there. We were hoping for a minister. She might come. I think some pressure on the health ministerial team at the moment because Jonathan's given them such a hard time. So here we are. Happy time. We've made some very, very good strides, and now we're going to go and do further good work. But first of all, we're going to. I'm going to look at Jonathan. Jonathan, do you want to speak next? Because I know you're busy shaking. Would you like to speak immediately? We've got three other speakers after, but would you like to speak now?
Well, yeah, okay. I mean,
Speak now.
I'd like to make a few very brief points, really, which is, first of all, to welcome this report and to pay tribute to you, Barry, for the leadership you have shown and the work that you do on these matters, not just in Westminster, but across the country as well. It surprised me that you have had lots of media requests and so on. You really did making the argument today. It is important. It's a timely occasion to launch this report, given that it's obviously we've all been. I've lost my badge. I've put my badge down, but we were all wearing our badges with pride at Prime Minister's questions today earlier in the House of Commons. But I'm the Shadow Secretary of State, so I speak for Health Matters Below Party, and of course today isn't a party political event, but I did want to come along and just reassure all of you that we in the Labour Party take the issue and the associated, connected issues with Autism extremely serious. We were very proud in our manifesto to have made a commitment to creating the conditions in which we can be an autism-friendly society. That is a commitment that we still stick to and we want to develop in the coming months and years. We don't know when the next general election could be, and we don't know who will win that general election, but it's certainly my hope that if I am given the extraordinary and privileged responsibility of being the Secretary of State for Health, that I am a Secretary of State for Health who puts autism at the top of the agenda and makes it a huge priority. That's why I believe this report is so important. It's going to shape and influence our thinking as a Labour front bench, but also I want you to shape and influence our thinking directly as well. So I hope in the coming weeks and months and years this can be the beginnings of an ongoing discussion and dialogue about the type of public policy initiatives and changes that we want to see in society. I'm not saying I've got all the answers, and nor would you expect me to stand here and give you all the answers, but what I can tell you is that I will be, and I am, a listening Shadow Secretary of State for Health who wants to be a listening Secretary of State for Health. So I hope we can engage in a good discussion. I'm quite excited by Barry's instructions for us to scatter across the country and take the report out there and discuss it with people and listen to people's views. And I think that is so important, because for us to make policy effectively in this place, it has to be informed by what people out in the wider community are actually saying and telling us. So I'm delighted to be here. I'm thrilled that you're launching this report today, that you've put so much effort into it. You've got my full support, and I hope this can be the beginnings of a very good, fruitful relationship between all of you and the Shadow Health team. So thank you very much, and enjoy the rest of the afternoon.
After tweeting his wonderful face around the world just then, can we have a quick photograph? Yeah. A bunch of us with Jonathan. Yeah. Front of the banner. By the banner. Come on. just a few. You come on. Let's try. Just to try here. Just to show. This is a low voice. Come on. United. one redemption, just one.
Wonderful. Thank you.
Excellent. Give yourself a round of applause. That was excellent. That was someone stolen my phone.
I've got it.
Right. We've now going to ask Helen Ellis to say a few words. We are going to, because we want you all to participate and to enjoy this occasion. Helen, where are you? You're sitting right there. We've got 5 minutes. You might even push it to 7 if you're nice to me. Okay, over to you.
I think Barry said half of what I'm going to say already, but never mind. So this report started life when one of the commission members, shortly after our last report, said, shouldn't we do something about quackery and fake cures? Well, the short answer is yes, we should. But it took a while to piece together exactly how to do something. We were at a loss to begin with as to whether responsibility even lay in legislation and just who we were wanting to talk to. And this wasn't a problem unique to us. Many people told us of their stories of how they've not known what to do when spotting a social media post advertising a false remedy, or heard someone recommending a treatment that sounds strange or dangerous. The continual expansion of the internet and social media has been a boon for a huge number of autistic people like myself. We use it to reach out to our community and support each other across fields and oceans. But there is a nasty edge to the internet, and the surface doesn't need scratching very hard to find the ugliness waiting to take advantage of other people's desperation and lack of knowledge. The fear that strikes into my heart is not of the charlatans and snake oil salesmen themselves. They've always existed, they always will exist. But it's that we as a community have become profitable. Being autistic is still seen as wrong and needing to be fixed. This isn't right. Parents will always search for ways to mould their child to their own ideas and initially struggle with things that don't fit their preconceived conceptions. You know the stereotypes. The son whose sexuality doesn't match his father's, the daughter whose lack of ambition horrifies the mother who broke the glass ceiling, the grandchild who just won't settle down and get a real job. But what we desperately need now is not to judge these parents, but to give them advice. Guidance towards support groups and autistic adults they can learn from. Guidance for school staff and medical professionals on how to report concerns about dangerous treatments they're hearing about. And guidance for us in how to tackle the huge giants of social media and to get them to realise that not every advert's money should be accepted and that evidence is needed before they start promoting treatments and therapies. But more than that, we need those who hold the power to regulate to step up and start taking responsibility. When it comes to vile treatments such as MMS, we need the MHRA to extend its cover to all healthcare products and not just those deemed medicines by the NHS. We need the Food Standards Agency to be clear about its remit, which does extend beyond just sandwiches and takeaways. We need more clarity from all the agencies with responsibility over what the public are told about products and how they can access them. And we need easier routes to advice and reporting. These regulatory bodies should be easy for us to use and hard to escape from those who seek to do us harm. There needs to be more repercussions for peddling these products, legal consequences, fines and prosecutions. At this point, though, I would like to thank representatives of the agencies who did engage with us, who came to our evidence sessions and spoke to us, along with all the people that responded to our survey. I would especially like to thank Dalmayne for her tireless work in this area. It's not easy to go out there every day and fight against people so entrenched in their mindsets that they don't see or care about the harm they're doing. We know that sadly we will never be able to fully stop the actions of abusive people in this world, but between Emma's work and our Commission report here today, we hope that we can make it harder for good people to get calmed down these paths, harder for the not so good people to make money out of these scams, and ultimately make it harder for people to find out about them in the first place. Vulnerable people are being targeted, and we lack the arsenal to defend our rights as human beings. We need to bring the guidance, legislation and regulations into the smartphone century and realise that having the world at our fingertips means we need to be more aware of what is out there, what hopes, dreams and snake oil is being sold to people. We do not need fixing, we do not need curing, but we do need supporting in our fight. If you wouldn't want it done to your child, don't stand for it being done to an autistic child.
That woman doesn't need any fixing, does she? When I first met her, I thought, what a talented woman. As I've met her many times, I now think, why the hell isn't she in here as a member of Parliament? Give her a real and she will be. Okay. So now let's ask Richard Mills, Professor and Dr. Richard Mills, to address us.
Thanks. Good afternoon, everyone. Well, between them, Barry and Helen covered most of the points I was going to make. But I would say that this initiative is long overdue, and I'm really surprised that it's taken so long. It's been rumbling on for years, and no one has really done very much about it. As Barry said, healthcare fraud is big business, and autistic people and children, adults and families are one of its many targets. But it's not just about the calculated, exploitative aspects. Some of this stuff that we see is very well-meaning. You know, it comes from a place which is not about profit. It comes from a belief system, which, as Helen has said, is about fixing autistic people. Now, that isn't to say that autistic children, autistic adults and families don't have problems. They do. They have huge numbers of problems, but these quack remedies are harmful and are part of the problem and they're not part of the solution. So harm is harm, and quackery is quackery, wherever it comes from. Now, there is a good advice out there. There's plenty of guidance available from the National Institute of Health and Care Excellence, much maligned, but the stuff on autism is pretty solid. There are some very good sites that are run by autistic people themselves. And the Research Autism website, which is now under the wing of the National Autistic Society, is another trusted source of information about these interventions, because the internet is awash with them. You know, we can I don't know how many hundreds there are now, but certainly the last time I looked, it was several hundred. Now, we hope to see further moves to fill the gaps that have been identified by this report. And I would also like to suggest that I think the autism strategy is currently being reviewed, and I think that this work should have a prime place in that strategy going forward. So it isn't just one of these things that is here today and this is it. We continue to work on it. Finally, and I say that most of the points that I was going to make have already been made, and the harm is not just about the obvious lunacy of ingesting chemicals and so on. You know, some of the other mainstream pharmacological and behavioural interventions are not that great either, you know, and can themselves be very harmful. But as Helen has said, it is the damaging narrative that comes out of this, you know, which I think is one of the things that leads us to treat autistic children, autistic adults differently than we do non-autistic people. And I think that the perpetuation of this narrative that these harmful interventions do is critical and must be stopped. So finally, I'd just like to pay tribute to Barry and his team and the Westminster Commission, all the Commission members and those agencies that have cooperated fully with this inquiry. I particularly mention Emma Dalmayne for her drive and persistence really in keeping this issue alive and certainly for raising it again with the BBC over this Hungarian chap who was offering shouting therapy down in South London. But certainly her persistence and her single-minded pursuit of it has helped us all. So thank you very much for that, Emma. And that's all I have to say, so thank you. Well,
Well done, man. And we've got another man, I'm afraid, for balance. Nothing wrong with the man at all. Gavin Wafer, who's from the Food Standards. And it's very kind of you to come. And very good that you gave evidence to the Commission as well.
Good evening, I'm Gavin Wafer. I'm the Head of Intelligence at the National Food Crime Unit, part of the Food Standards Agency here in London. First of all, I thank Barry for inviting me here today for the launch of the report on harmful autism interventions. I welcome the opportunity last year to contribute to the Parliamentary Commission on this issue and was grateful to be invited to today's hearing. Clearly, the Commission was also pleased I accepted because whilst it started off as an invite, very quickly another email arrived asking me to actually come and speak to you today, which I'm delighted to do. So rather than just be a member of the audience, I find myself standing in front of you, which is great. The National Food Crime Unit was born out of a serious incident around the adulteration of beef with horse meat back in 2013. But it was never our intent that the threat to UK consumers should have a narrow focus. Instead, we wanted to address all matters that fall within the Food Standards Agency's remit and that pose a serious threat to UK consumers. It quickly became apparent that there was an industry out there offering products for sale, generally via the internet, that falsely and maliciously offered cures for autism and many other diseases. The marketing of these products, of which MMS, most commonly known as miracle mineral solutions, and containing the chemical sodium chloride, or in other words bleach, was prominent amongst others. Advertising of MMS and other products plays upon people's fears, raises false hopes of relief, and targets some of the most vulnerable in our society. Claims range from generic statements around purifying the body to more specific ones around curing cancer and autism spectrum disorders. Its ingestion can cause nausea, vomiting, damage to the gut, damage to red blood cells, and potentially result in respiratory failure. Its promotion and sale is illegal and truly a danger to consumers. It's therefore no surprise to me that using our law enforcement risk ranking tools, which identify risk and aid us to prioritise our resources, demonstrated that MMS consistently showed a high and tangible risk to vulnerable people that needed to be addressed. I'm confident that our work over the last couple of years has allowed us to gain great experience and knowledge of how MMS and associated products are marketed and sold, and to do much more to combat it. Our work has included the dissemination of intelligence via Interpol and the National Crime Agency to Australia, USA, Canada, Mexico, Pakistan, Vietnam, Singapore, Thailand, China, Hong Kong, amongst others, to notify them that we have traced MMS sellers and manufacturers within their jurisdiction, and we encourage and support them to take action. We have traced around 50 UK purchasers who have purchased MMS and have warned them of the dangers that they may be taking. We combined this with notifications to local multi-agency safeguarding hubs to follow up. We've worked with online marketplaces to remove and delist products, and we've submitted abuse complaints to shut down websites, and together with local authority trading standards and environmental health teams, we've launched 6 joint enforcement exercises and interventions across the UK. We've recently launched a new initiative to include MMS within the Rapid Alert System for Food and Feed, or RASAF. This is a European member state-wide platform that informs all other member states and some third countries that an MMS seller or manufacturer has been identified within their jurisdiction, and more importantly, compels them to take action. I don't pretend this has been easy. The internet is a challenging environment to police, but we are having an impact, and indeed the National Food Crime Unit is leading the world in understanding this new crime type. Therefore, I welcome today's report as an important tool in raising awareness of harmful autism interventions, and note the concerns raised that the autistic community is unsure of where to report their concerns, and the call for a more joined-up approach from regulatory bodies. It may be prudent now to mention Food Crime Confidential, our website and phone number that can be used to contact us should anyone come across such websites. And indeed, we have an ongoing, enduring operation searching for these sites on a daily basis. Let me finish though by stating the work of the Food Crime Unit will continue in this area. We will continue to build on our experience. We will look for new and innovative law enforcement techniques to combat it, and we will do all we can to tackle the fraudsters and the fakers who peddle these products in order to protect UK consumers. Thank you.
Well, wasn't that encouraging? Yes? And real action and real way. 2 minutes. Just wanted to say one thing before, because I know that there's going to be a division in a minute, and I don't want the bells to ring and people will run out. I just want to say this, that we've written a good report, and it's as good as the people that put all that work in on the commission, the people that helped, both Emily and all the team. But also all of you, the people that did the questionnaire and the people who did all the work, who flagged up the best people to call for witnesses. And so it's a really good team effort. And I don't want us to congratulate ourselves and now say, didn't we do a good job? And we go home, get on our trains, buses and bikes and all the rest and think it's done. It's not. We didn't devise this as a cathartic experience. We designed it as a campaign. Now we've given ourselves the ammunition. We've got to go out and sell this product. It's a good product. We don't have to be ashamed of selling it. And we are, yes, there are a lot of people who tweet and use social media, who talk and have good conversations about the autism community and the challenges that is faced in the autism community. We don't do it enough, we don't do it professionally enough, and we don't use it in quite the way that we should do. So let's galvanise ourselves this summer, from now, let's get lots of stories about this report, tweet it, retweet it, really put some energy into it. Nothing to be ashamed about it, it's beautiful. Let's tweet about it. I've only got 12,000 followers, but some people have got millions of the things. So let's get onto their big sites. I'm looking at Dame Steve Shirley, who knows all about this world, and she knows, as I know, that although some pretty awful things are possible through social media, some very good things as well. And what I came into this for, because both the fact that when I chaired the Education and the Children's Schools and Families Select Committee, I knew that I owed a debt. I never did enough drilling down into this aspect of educational challenge. And so I always had a guilty conscience, but I also have a family member who's on the autism spectrum, and that is very personal to me as well. And so I'm not going to go away, you're not going to go away, we're going to increasingly become more and more effective in terms of doing the job we set to. I saw when my family had a member of welcomed a little member of the community who had serious challenges. I knew that if all the challenges my family was having in terms of what's the support, who do I talk to, how do I understand, how do I make how do I learn, how do I get support? Yeah, for a family that is very important to have as early as possible. Tomorrow we have a major backbench debate in the Commons on autism. Isn't that good? We've got that as well. And we'll be bringing those issues to the fore. And the one for me, absolutely still the most poignant, that somebody out there on their own doesn't understand where they are, doesn't understand where they can get the help that they need. We should be helping them to do that. Identifying, showing that there is a community out there who have the experience, have been through this, and know what's going on and how to do better than they otherwise would do. Yes? And Nick Dakin, who's just come in, knows more about autism than most people in the House of Commons. Yes? He's former Further Education College principal, and also I've got to be nice to him because he's my whip. Can we give him a round of applause? So, work harder,
There's much to do. We got a great team here. We like each other. We like working together. There's nothing we can't do together. Carry on doing it. Come on.